I'm here with Dr. Minocha from the Urban Spa in Essex, and we're also lucky enough to have Tara, one of his patients. Now, what other typical patients you see coming to you in Essex?
So typically in Essex, we see a whole range of patients who are essentially concerned about age-related skin changes, which manifests itself in terms of volume loss, for which we have a variety of dermal fillers, which are able to replace volume with minimal sort of downtime, a procedure that takes only 45 minutes.
Now, as you know, through a lot of these television shows, that Essex has been featured a lot.
Indeed.
Now, have you seen an influx in the amount of patients you're seeing? Are they younger?
Absolutely. I mean, people are much happier, much more comfortable talking about the sort of treatments, especially amongst friends in Essex, which has led to a huge influx in treatments being requested. So when you look at the mirror today, Tara,
Yes.
where are your eyes drawn to? What area concerns you?
I think at the moment it's these sort of nose to mouth lines here.
Okay.
I think they could do with sort of being slightly sort of smoothed out slightly. I think they're kind of make aging me slightly just here.
Okay, so once again, this is a very common area. I'll take that from you. It's a very common area to have treated, what's known as the nasolabial lines and folds. And what we can treat this with a dermal filler, which will have an immediate effect of softening the area, making the mouth look less sort of drawn and tired.
So Tara also mentioned that she goes to the gym a lot, and obviously that can cause kind of, when you're exercising, a loss of fat also.
Absolutely.
So you have to compensate it with something.
Absolutely. Absolute conundrum for women, I'm afraid. It's a tough life because they go to the gym and they wander around with size 8, size 10 bodies, which is fantastic. But unfortunately, the downside is that you also do lose volume on the face, which now can be replaced.
Great. Okay. Well, let's get started, and looking forward to seeing the results.
So what we're going to be doing today is using a cannula technique, which essentially is a blunt-edged instrument. Traditionally, one would inject a filler with a needle. A needle, obviously, being sharp, traumatizes the tissue, which increases the risk of bruising, swelling, redness, and pain. Okay. With a blunt instrument, this merely glides through the tissues and is essentially a painless procedure with immediate results, hence its popularity. Okay, Sarah, so we've just completed one side, which I think actually looks very nice. It's very soft, very natural. Please have a look in the mirror, see what you think.
Oh, wow. Yeah, it's completely sort of really smoothed that area over, hasn't it?
Okay, we're going to now do the other side for you, Tara. I can't let you go home just with one side done. Okay, and I think the art is actually to be quite subtle. Less is more, really, in this case. Often, unfortunately, you see in celebrities and in media, things have been sort of overdone, and you actually start changing the way somebody looks. I think the art actually is to maintain your face shape, but just to rejuvenate it.
Yep, great. So, great for a lunchtime procedure.
Absolutely. Zero downtime.
Great. And you're happy?
I am absolutely delighted. I just feel I look fresh, but I still look like myself.
And that's
I don't
important.
Look changed in any way.
Yeah. And you're going to be going out tonight?
I most certainly am.
Excellent. Woohoo! Good times.